Welcome to Cheddar, everyone. I'm Kristen Scholler, joined by Baker Machado.
Happy Hump Day, everybody.
That's right, happy Hump Day. And joining us now, too, is Robin Koval, CEO and President of the Truth Initiative, and David Casey, Chief Diversity Officer at CVS Health. It's great to have both of you. Thanks for joining us.
Thank you.
Thanks for having us.
All right, so your two organizations have teamed up to put an end to smoking on college campuses, and you are targeting historically black colleges and universities. So, Robin, we're going to start with you and tell us why it is so important, I guess, to focus there first.
Well, we know that the African American community and low-income areas, which often are the student bases for community colleges, have been the target of big tobacco for a very long time. Higher smoking rates among those populations. And so, we want to get to the young people before they ever start smoking, and certainly to help them quit early before they progress to be smokers.
Well, you talk about it being higher in those particular areas, but why is that? Is it because of signage that's in the area? Is it, cheaper to buy them in that area? Why is it so significantly higher there?
Well, it's a good question, and it's not an accident for sure. We know that there's up to 10 times as much tobacco advertising in black neighborhoods, for instance, than in other areas. We know that the density of retail stores in areas of low income is much, much higher than in other areas. We know that there's more tobacco advertising near schools in low-income areas. So, the more advertising you see, the more access you have to tobacco, the more likely you are to be a smoker.
Mm-hmm. David, why did CVS decide to partner up on this and be a part of it as well?
Our partnership with Robin and the team at Truth Initiative is part of a bigger campaign that we have called Be the First. And it's a $50 million 5-year strategy to really create and deliver the first tobacco-free generation.
Robin, let's talk about how many campuses are actually smoke-free on them. There are some of them that are. Are a lot of the historically black colleges, do they have smoke-free environments there, or are they smoke-free universities?
Well, some do, but there's a lot of work to be done. So about less than 50% of the 102 historically black colleges and universities have a tobacco-free policy. There are about 1,100 community colleges in the United States. About only 30% of those have tobacco-free policies. So we have done some work. We've been working since 2015 to advance these policies with about 135 schools. We'll be working with the CVS Health Foundation on about 100 schools. So there's a lot of opportunity, and with CVS's help, I think we can make some great progress.
Mm-hmm. And David, too, join in here and tell us, I guess, how specifically you're going about trying to make these changes and maybe what you've seen at least so far.
Yeah, I think we have an incredible opportunity first and foremost because, the smoking rate for teens is the lowest it's been historically. It's about 6%. But yet the health outcomes are just as bad, especially in lower socioeconomic communities and minority communities. So we still have a lot of work to do to actually get over the negative outcomes related to these issues. We're going to partner with Truth Initiative to fund $1.5 million to help these campuses go tobacco-free by December 2017. So Truth Initiative is actually going to take on the technical program delivery at these campuses with the funding supported by the CVS Health Foundation.
David, on the business side, when CVS decided to stop selling tobacco, we saw a significant drop in retailers that were also starting to sell it. Do we think that's going to start being across the board, that more retailers are going to significantly start dropping the amount of tobacco that they're selling?
When CVS dropped tobacco in 2014, one of the things that we'd hoped would be an outcome would be that people would actually stop smoking, that we weren't just sending them someplace else to get tobacco. And we just released a study in the American Journal for Public Health in March that showed that people who were exclusively buying their tobacco at CVS now have a 38% higher likelihood of stopping smoking because they don't have that access. So with that new data, we certainly hope that other retailers are going to see that you can empirically have people stop smoking by removing tobacco.
Mm-hmm. And Robin, let's go back to you a bit. I mean, what's the story here in terms of how you two came together and I guess why it is such a passionate point for both of you?
Well, we of course were great fans of CVS when they took tobacco out of the stores and working together. And, our efforts are really to how can we help young people stop smoking, prevent them from smoking before they ever become smokers. We know that 99% of people start smoking before the age of 27. So if we can get you before, while you're a young person, to never smoke or to not progress, we know we probably will keep you a non-smoker for life. And so, when CVS Health Foundation introduced their program, we thought it's a natural partnership for us to come together, and particularly on this college program, because we know that when we can actually impact, if all the 135 schools that we have programs in, if all of those schools have policies that take tobacco off their campuses, we can impact over 1.2 million lives, students, faculty, people who work at those schools. So, there's a potentially very big impact.
Robin, sticking with you just on the point of educating and talking about stuff, we'll throw some stats up here in a second. Teen smoking, because a lot of our viewers are millennials, are actually at 6% low for 2016, but yet, still smoking kills almost 500,000 people every single year.
Yeah.
Your ads are obviously effective. They're obviously working. So why do you think we're starting to see a sudden decrease in the amount of people, teens in particular, that are using it? Is it just educational purposes? You guys are doing more great videos that are resonating with them? What is it?
Well, there's a lot of things going on out there. So yes, we do have the Truth Campaign, and we know since the Truth Campaign was reintroduced in 2014 specifically for Generation Z, for millennials, we've seen decreases in attitudes, intentions to smoke. We've seen behavior changes, so we know it's working. We've got better clean air laws. We have a lot of things in place. There are other campaigns from FDA, from CDC, that are all denorming tobacco among young people. But what we also know is that certain populations still are smoking at very high rates. 6% is an average. So we know, for instance, LGBT youth smoke at twice the rate.
Why is that?
Well, they've been targeted also by the tobacco industry. We would say profiled, really, because they're really being singled out. And the same thing with young people of color, also singled out. People with mental health problems, 46% of the cigarettes consumed in the United States are actually smoked by people who have a mental health issue. So we're not done. We've made tremendous progress, but we have a lot more work to do.
David, you were nodding your head during that. What do you have to add to that?
I would just add to that, most people who smoke actually want to quit. We were talking about that this morning, but just need a catalyst, something to help them get there. Mm-hmm. So we certainly believe that removing tobacco from the environment where people live, where they learn, where they play, would certainly ease in that ability to quit smoking, because most people actually do want to quit.
Mm-hmm. And also, too, we know that your organization, CVS, is partnering with the American Cancer Society. So tell us a little bit about that partnership as well.
Yeah, and that partnership as well is also about the broader Be the First campaign. And we're partnering with the American Cancer Society and a number of other community-based organizations and not-for-profits to, again, deliver this cessation programming to the communities in the most need that Robin mentioned.
All right, Robin. Well, we're going to give you the last word here in terms of, we've heard about why you're so passionate, both of you are so passionate about this and where you're seeing it. Are there any particular personal stories that you can share with us in terms of maybe some of the students that you've been in contact with in some of these areas on some of these college campuses, or any, personal story that you can weave in here?
Well, one of the things we know about these programs and why they work is it's got to be a top-down, bottom-up approach. So one of the things I think that's been so gratifying as we've worked with these campuses is when we see the students themselves come out. We just did a program, it was actually, I think, on Move-In Day at Howard University, one of our HBCU campuses, where we had, tons and tons of students out with posters and placards and everything like that. They want to bring these policies to their campuses, and that's really the most gratifying thing.
And I'll tell you, from a personal standpoint for myself, not necessarily from a student perspective, but my mom passed away from complications related to lung cancer about 10 years ago. And to see someone sit there on the edge of a bed struggling for breath like a fish out of water is nothing that I would ever want for anyone to have to experience. So anything that we can do to prevent people from smoking to begin with, and certainly to help them quit, I'm all for it.
David and Robin, thank you so much for joining us. We appreciate it.
Thank you.
Coming up, guys, is the research company Qualtrics eyeing an IPO. We'll find out. But first, some other big stuff, including some headlines from our friends over at Newsy.